Hi, all. My name's Jason Resendez, and I'm the president and CEO of the National Alliance for Caregiving. And welcome to this session on supporting care partners, an issue that's often overlooked, but that connects so many of us. In fact, there are 53 million Americans providing unpaid care in this country. That's 10 million more today than there were in 2015. And that care is a common bond that so many of us share, including my fellow panelists. So I'm excited to introduce you all to my fellow panelists who will each introduce themselves, but I'm excited to be joined by Sue Peshin, family caregiver and president and CEO of the Alliance for Aging Research, a proud member of the National Alliance for Caregiving. Colin McConnell, autoimmune caregiver, visually impaired artist, an author, philanthropist, entrepreneur, community advocate, and also Sheila Gouch, principal and clinical director at the Dearborn Academy. So excited to be in conversation with all of you. And I'll turn it over to you first, Sue, for your introduction.
Oh, sure. Hi, Jason. And thanks so much to the Autoimmune Association for having me today. And, to all the folks who are there for the community summit, hope you have a wonderful summit. It's certainly an awesome group. So as Jason said, I'm Sue Peshin, and the Alliance for Aging Research, the group that I lead, is a national nonprofit in DC. And our mission is to promote research as a way to enhance aging and health. And we work in both health education and public policy. And I've been a family caregiver for my mom for the last 3 years, both for her arthritis, severe arthritis, a number of other conditions, and now dementia. And it's wonderful to be here.
Wonderful. Sheila?
Sure. Hi, I'm Sheila Gouch. I am a mom of 2 children with PANS-PANDAS, which is an autoimmune illness that impacts comes with neuropsychiatric symptoms. So I am a caregiver for my two children. And then I'm also the principal and clinical director at Dearborn Academy. And we do a lot of work here at Dearborn supporting families. We have a lot of families here who have PANS-PANDAS. And so we do a lot of work on kind of talking about caregiving and kind of breaking that down to really support caregivers best, how we can do that. Thanks for having me.
Wonderful. I think we're having some technical difficulties with Colin, but I see that he's maybe audio only. So Colin, if you can hear us, love to get an intro. Okay, well, while Colin, you're muted. Welcome to the world of virtual summits.
We hear you.
You hear me?
Yeah,
yes.
Go ahead.
Okay, I am sorry. I have no idea. It kicked me out originally. Anyways, my name's Colin. I'm a visually impaired artist from Detroit, Michigan. I was born with a rare optic nerve damage, so I'm considered legally blind, hence not being able to figure out how to get on camera. My mom was diagnosed with multiple sclerosis at the age of when I was 10 years old. And I basically had to introduce her to my world and became pretty much co-caregiver with my father up until the day she died.
Well, thanks so much, Colin, for being with us and navigating these difficulties. And today we're talking about the different challenges, but then also the deep commitment and fulfillment that comes with caregiving, right? Family caregiving is one of those issues that we're all touched by at some point in our lives. For me, it was at first through my mom. I watched my mom raise 3 kids while working a full-time job and caring for my grandmother, who battled multiple chronic conditions, a dynamic all too familiar in Latino households across America. And she provided that care out of a deep sense of love for her and for us and her family, but also out of necessity. There was no alternative. And that care came with consequences, as it does for many caregivers. And we'll hear more about that in today's panel. But we know from our data, caregiving in the US, that over 40% of family caregivers find themselves in high intensity care situations. We see caregivers reporting that it's becoming more and more difficult to coordinate care for their loved ones and navigating the healthcare system, navigating access challenges to therapies and interventions. We also see that nearly 40% of caregivers experience high rates of emotional distress due to caregiving. In fact, 11 million caregivers in this country report that caregiving has made their health worse. That's all due to care and the challenges that we put in place to provide high quality care for our loved ones. And so those are just a few of the challenges that we see at the meta level, but I would love to turn it over to you, Sue, to start to bring some of these challenges, some of these data to life, right? Can you talk a little bit about the challenges that you faced as a caregiver for your mom?
Sure. I mean, there's a number of challenges. I would say when you talk about caregiving challenges, you're talking about it for both the family caregiver as well as the person that they're caring for, because you kind of become a bit inexplicably linked. And so in terms of the way providers will address you, it's not usually at an individual level. It's to, one person. There's often an accusatory tone. If something is going wrong and a caregiver is there, then it's, something that they were doing wrong, and that's why the person's not doing well. It couldn't possibly really be related to clinical care or some kind of need to change, the course of the discussion in terms of the treatment path. There's a lot of stigma, related depending on what the conditions are that you're dealing with. And then there's a lot of isolation. And I would say, those are the main barriers that I've experienced on a personal level, and a lot of the people that we work with have related to.
Absolutely. Sheila.
Yeah, I think for myself, especially caring for really sick children, I think there's something that some of our caregivers here at Dearborn talk about, the difference between like caregiving and parenting, right? And just the struggle in you are really caregiving sick children, and how challenging it is that you kind of miss out on those typical parenting things, right? Like whether it's a typical birthday party or being invited somewhere or going to that football game with your child who actually gets to play, or, things like that. I think, I really resonate with the stigma piece. Certainly PANS Pandas comes with a lot of mental health stigma for sure. But there's also like this complicated way that caregivers are asked to bridge into different systems, right? And learn different languages and be de facto caseworkers. And really those times when you're just sitting realizing like, I don't know how to help my child. I'm their best advocate. I'm not an expert in whatever space, whether it's autoimmune, the autoimmune illness that they have, you become the expert, but you're not a medical or a doctor. You might be, I guess, but and so really those sitting in those providers meetings and realizing you're the expert on your child, but how do you create that bridge to also allow experts in and feel, and sitting with that shame and the stigma and all of that, it's just so much. So.
Yeah, absolutely. That's something that we hear a lot, right? Sort of when, especially it's one of the common entry points to care is even for folks who are, MDs or professional advocates, when that caregiving role comes into play, you really are a lot of folks kind of still struggling to figure out how to navigate this. But at the end of that journey, the more that you're engaged in that, there is this really deep expertise that comes with providing that care. And it's that expertise that frustrates so many of us because we look at care as being unpaid. Just because it's unpaid doesn't mean it's not unskilled, or it doesn't mean that it's not labor. So you make a fantastic point about the really rich skill set that you develop in providing care. And I want to ask a question. I know we lost Colin due to some technical difficulties. So if he jumps in, we'll all hear him and maybe we'll see him. But thinking about that skill set, what are some of the tools that you both use to navigate care, whether that's support groups or online tools? You're just interested in how you adapted to your caregiving roles. Maybe we could start with you, Sue.
Sure. I mean, I do think that speaking to peers who are in similar situations, and one thing I have to say, it's been incredibly humbling for me because For years, I worked in the Alzheimer's space without having a loved one that I was directly caring for. And it's very easy when you're outside of those situations to sort of say, here's how to validate and communicate, and, and you shouldn't disagree and all of that. And then I'm, now sort of interacting with my mom and I'm like, don't you remember, and I'm saying all those things that I tell people all the time, don't do that. So I think it's really important it's definitely given me a completely new lens into what, people are dealing with. That it's much easier to preach than it is to practice. And that there's just so much that is not available to caregivers that ought to be in the way of resource. I mean, I'm much more fortunate. I have experts I can talk to. We belong to groups like yours, Jason. You have incredible resources. I recommend everybody go to the National Alliance for Caregiving website, take advantage of what they have, other caregiver groups at the local level. And I have done some of that. But I just think you need to just go after whatever is available. Make sure you go to reputable websites. There's so much misinformation out there today. And so I think science-based, NIH-based, FDA, CDC, federal agencies, all of that to get your medical information is key.
Wonderful. No, absolutely. And thanks for the plug, caregiving.org. And I hear that Colin is back. And so, Colin, if you want to jump in, the question is, what tools have you taken on to help navigate your caregiving role? Let's see, we see Colin and hear Colin, but can he hear us? So while we figure that out, let's turn it over to Sheila.
Sure. So I think the challenge, particularly with children with, kind of significant needs, is the level of isolation that honestly we often feel. I think particularly that, coupled with the mental health stigma and kind of the shame around it. Like, I've done a lot of work to kind of break down, like, why was it so hard for me to ask for help? Because it was really hard for me to kind of find those support groups. It was the best thing I ever did when I finally found my Special Ed Parent Advisory Council, which is a great resource for parents, CPACs. And just that you found another group of people, right, who were kind of doing a similar role as you. I think the challenge for me was really trying to figure out, like, why is this so hard to either ask for help or bridge in? And I really started to break it down as, like, I'm in a chronic stress response, right? Like, I'm chronically in fight, flight, or freeze. And I'm a fighter, to be honest. So it makes me a good advocate. That's great. But it also is really confounding, and it's not healthy to kind of be in that state all the time. And it's a state we're in as we're trying to care for our loved ones, especially if, like in my case with, children who are, feeling acute suicidality, or like, that's actually, you need help and you need support and you need to be able to reach out. So I know for myself, like, I actually kind of did a lot of work to figure out, like, why is this so challenging and all of those barriers? And then how do I really understand it through the lens of stress and anxiety, so that I can kind of take back some control, if that makes sense, and then kind of bridge in to find those supports. And so I'm really trying hard to, like, use my own voice and model for, like, how do we just start talking about this? Like, how do we say, this is really hard and I'm not doing okay right now. I'm really scared and sad and I'm stuck in my house and I feel really othered. So I think it's really hard and we need each other, truthfully. So.
Mm-hmm.
Yeah, absolutely. I think it's that, you've both given powerful examples of the power of community, right? That's one of the most amazing things about being a caregiver, is that you're part of this, what we call Caregiver Nation. There's 53 million folks providing care, and that's all comprised of all different kinds of sub-communities. But that lived experience and sharing that lived experience, creates not just a sense of empowerment, but also an opportunity to learn and to better navigate your own experiences and contribute to others as they navigate. So that word of mouth, that peer support, is one of those things that we hear most often when it comes to really critical resources. I'm just curious, how did you find, right? Because you both alluded to how hard it is when you first take on that role. The learning curve is steep because no one
Mhm.
is trained to be a caregiver. And so, how did you navigate and find those support groups that worked for you initially? Let's start with Sue.
Sure. I mean, there's a number of ways in the aging network, through area agencies on aging, through local chapters of disease-based organizations like, the Alzheimer's Association or Alzheimer's Foundation of America. There's, a lot of different resources in the Alzheimer's space for Alzheimer's support, which is terrific. So that's where I found that kind of support. And then in terms of just like the actual caretaking, that I think is a lot harder. Like just knowing how to do things, deal with, skin issues if they come up, or, other types of continence issues or things like that, we just, that's where I think the stigma enters, that we don't kind of talk about those nuts and bolts things that much. And clinicians just don't have the time to address them. So you have to just do online research, talk to other caregivers, find out what they've learned, and and go from there. But it really is iterative.
Absolutely. Sheila.
Yeah, I mean, I would say it's really challenging when especially when you have young children who are not doing well, like, because I do think you're stuck in that role, right? That dual role of like, now you're caregiving, but you also want to be parenting your child and trying to have some sort of normalcy and typical childhood experience. It's so isolating, it feels like.
Mhm.
So I think, for me, it was really, I almost had to learn how to do the opposite of my stress response. Like there are times that I just wanted to freeze and hole up in my house, and really doing a lot of self-talk and self-care of saying like I'm really worthy and deserving of having other people help me. I think asking for help was always really hard. That might have been my Achilles heel, if I'm being really honest, as a human. Then I had these two sick kids, and I really had to learn, like, I have to start stepping out of my house. I mean, I felt like we were kind of, I used to call it the island, the like Gouch Island, right? Like we're kind of by ourselves in our house all the time, and figuring out how to just go out and greet a neighbor and say, I
Yeah.
need help, right? Like no one brought me casseroles or set up meal trains for me, to be honest. And I think that's a lot of people's experience with chronically ill children, is that you have to kind of step outside your comfort zone and start asking for help, and going knocking on, like, going to CPAC was the best thing I could have done to meet other parents, but also like those online Facebook forums. And, I found a lot of community just in online groups, and really, going a little bit out of my comfort zone, to be honest, but sharing our story and really hearing people talk back and say, at you, and saying like, I get it. Like, I see you. I think it's this feeling of being invisible sometimes as well, that we need to be seen and
Mhm.
really and heard and valued for what we're carrying, and how hard it is sometimes, and we need other people. So I really agree with the community piece, and I think that community can fall away sometimes, especially for a lot of parents, honestly, because you just with young kids, especially, like, you just, family and friends, it's such a big burden anyway to have young children. So
Yeah,
Yeah,
I mean,
absolutely.
can
Go
I
ahead,
just
Sue.
add something, Jason?
Yeah,
I mean,
please.
I really appreciate everything you said, Sheila. I just want to put it out there to folks that, you know, even when you have like, you're taking care of an adult parent, people
yeah,
aren't bringing you casseroles. So,
no,
I mean,
totally.
it's,
Sorry,
and there's a lot of,
yeah,
and it's,
for sure.
it is very different. Like, I'm just, as a parent as well, I, raised two boys, like, changing babies' diapers versus changing adult
Yeah,
diapers
for
is
sure.
very, very different. And,
Yep. Yep.
And again, like there's a lot of stigma around that, and just even like learning, talking to people about like what kind of care items do you get, how do you keep someone dry, all these types of conversations. Like we don't, and there is this sort of assumption like, oh well, your parents took care of you, so now it's your turn to take care of them. And you may also be in a similar situation where you still have kids at home, and you have a full-time job, or other things. And that's why I think the work that caregiving groups like Jason's is so important, because we're not it's very hard to find help. You talked about reaching out for help, and you can get help in little bits here and there. Sometimes you can get some respite, but there's workforce issues today. It's very expensive. If you're wealthy, caregiving is available and there are resources, but that is, I think, one of the biggest barriers that people face, and that kind of cause that panoply of other things where we're in that stress response, we're not taking care of ourselves, all that. Resource, I think, it's such a huge barrier.
Well, it's so interesting you say that, because I'm definitely now in that sandwich generation, right? And caretaking my parents and my in-laws, and it is a much different. It's different and it's similar, right? But it's so important. And the resources, you're right. I think that's actually a really great point too. Like, to be fair, like I was finding kind of online or free resources to have support, not to get help. The help resources are different, and they are actually not as accessible. And to your point, you really actually have to either be wealthy and be able to bring in care, or know the resources, right? Like I know at Dearborn, we kind of helped families by interacting with an organization to kind of give care coaches to our families to kind of help with that critical resource, and that link between because just navigating, like, how do I get on Mass Health, or how do I get a Department of Mental Health, or, how do I get these applications done? How do I get state services in, or how do I get, it's so complicated. That's a great point.
Yeah, no, absolutely. You both highlighted that one of the most painful realities of caregiving is how invisible it is to the systems that we have in place. And the caregiving is work. It's skilled work. It's change. It's a complex medical tasks, and we have a system that relies on the folks like you to take up and provide those highly skilled medical tasks, yet offers no support. Very little training. We know from our data, over 60% of caregivers are engaged in multiple complex medical tasks on a daily and weekly basis, yet over 70% have never had a conversation with a provider about how to execute those tasks, how to do those tasks better, how to provide care better. And so we're starting to see some change in that respect. So thanks to the continued work of folks like you speaking up, sharing your story, we're seeing movement. As we have just a few minutes left, and I know we have some folks probably on in the virtual, I was going to say Zoom room, but then, hey, we're not on Zoom. In the virtual room that maybe are new on a caregiving journey. As you think about where you are in your journey, and you could give advice to yourselves starting out on this, or advice to a new caregiver, what's your number one piece of advice that you'd like to give to a person starting out in this care journey?
Oh gosh, that's a great question, Jason. I think just to Sheila's point, I think don't be afraid to fight. People need, and I don't mean you have to be aggressive or rude or anything like that, but you have to advocate, for your loved one. It's like, I think sometimes when I'm in appointments with my mom, like, what do people do that have nobody, to go with them? So even though someone may talk down to you or accuse you of, not doing something right or whatever, like, just it is a good thing just to be there for someone else, and you are doing the best you can. And reach out for resources, information, help. None of us do this perfectly. And you should also be taking care of yourself too. Don't forget to do that.
Yeah. Yeah. And I would really say, to echo that point, just really, you are the best advocate likely for the person you're advocating for, right? I know as a parent, like I feel like I'm the expert in my children's illness. Like, and I may not be an MD. I am a social worker, and that's still complex for me to navigate mental health, right? But just really, knowing your own worth and knowing that you're doing a great job, and really that self-care is so critical, because if you can't, kind of be able to ask for help and look for resources, and also just know when you don't know something. Like there are so many times I'm like, I don't know. I have no idea what I'm doing. Like who might know better than me? Like, can someone help me? And I think just finding access to resources, that's the key, truly, if possible, and using all of them.
Well, thank you both for sharing your lived experience, your expertise, your passion for this. So we deeply appreciate that. Sorry, Colin, we didn't get to benefit as much as we wanted from your experience, but thank you all for being part of this conversation on family caregiving, and good luck and stay strong as many of you take on this essential role. Thank you. And thanks to the Autoimmune Association for having us.
Thank you so much.
Thanks so much. Bye.